This is Charter Local Edition. I'm Brad Pomerance, and we are joined today by Clara Fellow. She is with the East Valley Community Health Center, which is doing such remarkable work in the San Gabriel Valley. It is growing, it is expanding. Talk to us about the early days of the center in West Covina.
Absolutely. We started in the 70s.
Oh, wow.
Just as a free clinic that provided family planning information and services. And it grew, and today we have 4 clinics and a full spectrum of health services for primary care, OBGYN, HIV treatment and education and testing, pediatrics.
So it's not just family planning, reproductive health.
No, that was the beginning.
Right.
Today we are a full service health center.
And so let's talk about where you are today. You're in West Covina, then you opened in Pomona, then you opened in La Puente, you recently opened in Covina. You have a mobile HIV testing unit. I mean, you are serving literally tens of thousands of patients every single year.
Absolutely. Actually, you know, our number is about over 100,000 patient visits per year.
It's remarkable. And to think that the need is so great. Jobs, over 250 people are working for the clinic. I want to speak with you about your clientele, because it's undeniable that healthcare and the delivery of medical care is going through a revolution. Whatever one may think about the Affordable Care Act, it is here, and when we look at least at the state of California, one could argue it's working fairly well.
For our families, it's working. You know, we have hundreds of families that are underemployed, unemployed, or have employment, but they really have to work really hard to make
2 jobs maybe.
Yes, or sometimes 3 jobs. Therefore, these jobs not necessarily offer good health insurance or insurance at all. So we are basically taking care of all these families that you know, are a very high percentage in our society, and provide them all the services they need, and also help them obtain health insurance. We have what we call the patient navigators.
And let's talk about that, because I think that is really where the revolution is in healthcare. Because prior to the Affordable Care Act, really all an organization like you had, you can turn to Medi-Cal, you could turn to Medicaid or Medicare if it was an elderly person or disabled person, maybe donations, maybe private insurance, but if they had private insurance, probably they would go to a private doctor.
Absolutely.
But now there are so many options. There is Cover California, and there is the Medi-Cal Medicaid expansion. So explain to me how your clinic is working to expand health coverage options for folks in the San Gabriel Valley.
So families come to us, and we also do outreach events to find families. And then we have enrollment counselors, a group of about 12 bilingual counselors, and they sit with the family and go into the computer to find Cover California and all the options that work for them.
And I want to ask you about these individuals, whether they are monolingual in Spanish, in a Chinese dialect. Early on, through the adoption of the Affordable Care Act, there had been some suggestions that communities that may be of Latino descent or Asian descent, a little nervous about signing up for a government program. It could be, even if they had documented status, they were fearful of simply having their name in a computer where the government would know who they are and where they are. They may have family that wasn't documented. It could be if they come from El Salvador or China, you know, coming from dictatorial governments. They don't want to get involved with the government. Did you understand that to be the case with some of these families?
In centers like ours, no, because that's why we exist and are the way we are. If you come to our center, you will see that all of our front desk employees could be the family of the families that we are serving. So they feel comfortable from the get-go.
And so you can really calm their fears.
Oh, absolutely.
Because
they feel that they are talking to their daughter, their son, their sister. And actually, you know, they come from families just like the families that we are serving. Right. So they understand there is an empathy level from the instant that you walk in. And so that fear, if exists, it gets evaporated right away.
And as I understand it, in a lot of these families, especially those in the Latino community, the mujer, the mother, you know, kind of sets the tone. And if you can get the mother to say, we're good, this is a good program, you kind of got the whole family. And like you just described, that's being done because there's a familiarity between your staff and otherwise. And actually what I've learned, Clara, is that as the Affordable Care Act has marched through the process, we're now, I guess, into year 2 or 3, the Latino signups, the Asian American signups are really going much higher.
Yes.
And how does that benefit your clinic, though, that these folks now have some form of insurance?
Well, it does, because it allows us to grow. We have had to increase the number of doctors, the number of nurses, and the number of medical assistants, physician assistants, and actually the number of facilities. Right. So as I told you, 2 years ago we had only 2 facilities. Today we have 4. That means that really the system has worked in terms of expanding options in different regions in San Gabriel Valley.
And how does that help your clientele? The fact that they can go to you first and not have to wind up at an emergency room, for example.
Oh, it helps, especially the health system in general. It helps you, and it helps me, and it helps everyone.
Explain.
Because if they come to us first instead of going to emergency care facility, the cost is much cheaper. Therefore, the whole system is not absorbing unnecessary cost. I mean, the difference between the cost of a visit in a clinic like ours could be $160 compared to $3,000-$4,000 to the visit in an emergency room.
Right.
Absolutely.
I know you also have worked for many years, and there's information on the screen about your family health festivals. They are frequent. They go on. I mean, every time I see you, there's another one coming up. Talk to us about the family health festivals.
Well, this is a great opportunity for families in San Gabriel Valley to learn about the services and the resources that exist in San Gabriel Valley. So East Valley Community Health Center is teaming up with Kaiser Permanente, with Queen of the Valley Hospital, with Citrus Valley Partners, and with Prolacta, with Care First, and actually with San Gabriel Valley Tribune, who is helping us promote the event. And City of Hope is also going to be part of it. So we will be giving cancer information and treatment information. We will be doing free glucose test, cholesterol test, diabetes test. For diabetes, there will be a tremendous number of services. As an example, we will have foot care and wound care treatment and information
Interesting
for
you
people.
mentioned wound care. I didn't realize how serious a wound can be for the elderly or for the diabetics.
Right.
I mean, they could literally fester for years. If they are not treated properly. And that's why having clinics like East Valley and health festivals.
Yeah, so they learn, because all these providers are offering services. Another important service we will be providing is people need to learn about hospice care and home care options. You know, does the senior citizen want to stay in their own home? What are the options? Do they need to go to a hospice? How does that work? What does it mean? How does end life occur to you?
I want to thank you so much for joining us. She is Clara Potus Fellow. She is with the East Valley Community Health Center. You can find them at eastvalleyhealth.org. My name is Brad Pomerance. Thank you so much for joining us on Charter Local Edition.